I think if there are one or two questions on that, yes, please, and one and two, please.
Are there any data regarding resumption of menses in these cases? This is number one. Number two, if they are willing to get pregnant, do you have any data regarding this issue in these cases?
We have not yet published data on the use of Proxeed since we have just started now on this, but we have some of the patients that have been already tested in this protocol that get pregnant after 4 months of treatment, between the 4th and the 6th months of treatment. These are unpublished data, it's just a communication that I give you to you. The trick of this is just the restoring of the ability of the hypothalamus to control the ovary. This is not really a disease, it's just an accommodation. The body is defending himself from whatever is altering probably the neuroendocrine control of reproduction. The ability of our body, our biology, is to be able to cope with the environment. And the ability to reproduce in females is something like the radio inside the car. If you have the radio, you hear the music. If you do not have the radio, someone steals you the radio, you can drive the car and reach from your place to the homework or whatever. You do not have music. You can whistle or maybe sing. So it's a sort of optional. You have to survive. So the biology of reproduction is the last in terms of importance, just to protect in our biology in terms of females. If you are a female, the last important thing is to be able to reproduce, but you have to survive. So all the energy are not stored for reproduction. It's for the brain, for the kidney, for the lung, for the liver, for the stomach, for your eyes, for the ears. You have to survive. You have to be able to run. Our biology has not moved and changed in the last 30,000 years. We have invented the fridge, and we have the cooling system, and we have the heat system in the last 30, 50 years. So our biology is still thinking as during the Neanderthal age.
Thank you. You are coming from the fast. Okay, we have now another question. Professor Nappi.
Alessandro, Rossella Nappi, Italy. I want to ask you something. Beautiful data on women. And I was thinking, do you believe that the effect that we see with Proxeed in men, it's not only related to something happening into the testes for the spermatogenesis, but maybe is a central effect on LH and therefore on testosterone that is capable of improving what's happening at the periphery?
I'm perfectly convinced on this. There is very few data on the control of the neuroendocrine axis in males. We are still working on the spermatozoa. And probably we are working this as we might try to check what is going on the oocytes in the females. Spermatozoa and oocytes are the same gametes. But the only problem is that we might find that probably the amount of the rightly working FSH in the Cial's acid contents probably might be changed in these women, in these men that are improving fertility. Since if the numbers and the ability of spermatozoa to move are improving with little changes in the hormonal levels, probably is the quality of the hormonal signal that is changing. So the idea is perfectly interesting.
Thank you. I think that also in the last session we will hear about sexuality, because also this is another point. In all the data that we have, they were presented before, no data were about the number of sexual acts, the number of ejaculation during treatment, if it is changing or not according to the normal behavior preceding the treatment. But probably you will speak later on also on that point. Thank you very much. Thank you, Patrizia. Thank you. It's also very important to have this point of view that show also that, that the system oocyte is also sensitive to the new changes in the environment. Please, the paper is open for discussion, comments.
My question is, have you data on the use of carnitine and premature ovarian failure, comparing to the use of Proxeed and L-carnitine on non-obstructive azoospermia? The same idea. So do you have data on this, on premature ovarian failure?
No, at this moment, no, because we are focused only in the ovarian process. But I think that it will be interesting just to study also this field. Yeah,
Okay.
because all together can give an answer of what fail. I think that we can amplify also the study with gene expression analysis, because it is easier and you can compare male and female. I think it's probably better make this study, so compare the male and female genomic and gene expression, just to see if there is some difference between the genders.
We are doing this essay in our clinic, so that's why. Because for men, there's improvement in TZ extraction in non-obstructive azoospermia after use of Proxeed. We have better rates of sperm retrieval.
Okay.
And the same idea can be compared for women.
Absolutely. Okay.
We hope so. Okay, thank you.
Please, if you have any other question, yes, the microphone here, please. Second row, the gentleman. Yes.
It's my question for the Proxeed women to start in the IVF cycle. The starting day will be the same stimulating day, or you start before the IVF cycle?
You mean when to start to treat patients with Proxeed?
Yeah, when do you
Well, the idea is that if you want to conceive naturally or under an IVF program, you have to start with, in my opinion, with Proxeed 2 months before. You need to give oil to the system, to the mechanic part of the ability of the reproduction to work. Since if you do not give time to the system to balance all the abilities, you are not able to get any kind of significance. I can tell you a story. We have used inositols, which are completely different story, in PCOS patients. If you treat them for at least 2 months, you get better results. If you treat them for 7 days, you get no results different from those treated with placebo. So this gives you a clear idea of how things might work.
I would like to have also the opinion of Patrizia on the biology of the oocyte. But just to answer that question, in IVF cycles, if we can believe that the addition of acetylcarnitine, carnitine, and old cysteine and so on can have an effect, this, and if you believe to the biology of the human oocyte and the follicle maturation, when you believe that the treatment should be started?
Absolutely, I agree with the previous treatment. So I think this is a good idea to treat patients just when are in the age, in the right age, like 20 and go on, because there is we are speaking of balance between some metabolic processes. So it is important to start, yeah.
And then the answer is to start the treatment absolutely before. Yeah. Thinking also that we are trying to have an effect. You know, in human biology, you have your eggs since the 12th week of pregnancy from when you're inside your mother, but they will be activated and they will bring to the meiosis and so on in a later on period. But this period is not only that occurring in one cycle, but needs a longer time. Yeah, and then if we want to act with biological factors, improving the biological quality, this means that we have to start absolutely early.
Before, yes. Absolutely, I agree.
Yes, there are other questions, or? Yes, please, the madam.
I'm Dr. Asma from UAE. I must say, mind-blowing lectures. Well, I don't know, maybe my question will be very silly, but L-carnitine has got very nice effects on quality of eggs, as you have already very nicely predicted. Can we use L-carnitine or carnitine in any aspect in embryology? Because we are now using IVM in vitro maturation. So have you ever you used any in vitro use of L-carnitine on maturation of eggs or on embryo quality improvement? Have any data?
Yeah, we make this study in murine systems, so only in animals. We treat the female for 3 weeks with carnitines alone or in combination. So this is data that are performed with in vitro fertilization experiments.
But in vitro maturation, now we have no data.
No.
Okay.
They are not yet produced any data to add in the in vitro maturation system, also carnitine or any one of these. As you know, we are now using only the culture medium as they were, but up to now
Because I was
we
thinking
don't know.
this
We
is
don't know.
gene-oriented and you are having loads of premature eggs with us, so we can do a lot of work on premature eggs and having
Up to
effect on
now-
embryology.
Yes, up to now, they have not been produced any data, neither in animal models nor in human. Then we cannot answer.
And regarding recurrent implantation failure, now we are having lots of patients in IVF, we are having problems of recurrent implantation failure plus early pregnancy loss. So is there any of your suggestions for L-carnitine effect on such embryo,
Well, the story of the implantation failure, as well as the abortion after a few weeks, a couple of weeks, are really dependent on too many factors. It might be also depending on the hormonal patterns that these patients might have, so that have the preparation of the endometrium to be the right location for the trophoblast. So it's a more complicated story. But also the carnitines might play a role, since carnitine is relevant for whatever cell.
Yeah.
So we might think also that a supplementation is able in an absolute way to patients looking or seeking pregnancy.
And one question is, what is the contraindication of use of L-carnitine?
We do not have any contraindication up to now.
And what is the excess of dosage? If
We do not have any excessive dose up to now.
Okay.
Yes, please.
Abdullah Ali from Lebanon. Just to go back on when to start the treatment, just one single question. Are you proposing to start Proxeed Women for every woman that desires or wishes to get pregnant soon to improve the quality? Because as you said, the oocyte needs 375 days to mature. So basically, if we are to have the maximum effect of your medication, we should need at least 375 days. Okay, so basically we should start 1 year earlier to get the maximum effect. I'm not saying that she will not have a partial effect if you start it now, but if you should start 375 days earlier. So this is what I'm saying. In case of hypothalamic amenorrhea, we can start whenever we can because we need to have the effect as soon as possible. But in case we are calling about we want to improve the quality of the oocyte, we need to start it at least one year earlier. This is what I got.
Yes, this is a very good point, very good comment, and we do agree with you entirely. But I mean, at a certain point, you have to start. I think we were concentrating also on the ovulation, after ovulation, the actual phase, not just the total 365. But yes, I mean, future studies.
Some effect, but it's not the maximum effect.
Yeah, it's not the maximum effect. Well, we are starting to see the effect.
Yeah.
I think this is important, and I mean, also we have to look at the phase, not only the oocyte quality. When it's fertilized, the egg is remaining without any form of energy until it implants. It's like 5 to 7 days, the travel in the fallopian tube until it embeds in the endometrium. And we are also targeting that in a sense, because if there is not enough energy already for that oocyte to travel that distance, it's just going to die and be rejected. And that is another big factor that people don't look at.
And maybe this plays a part in aneuploidy also.
Yes,
exactly. Okay, thank you.
Yes, another question. If this is the last question, then we will move to the next session.
My question is when on which criteria you are based to qualify the oocyte quality? Because you say oocyte normal and degraded. Degraded is apoptotic, you know, but it's not. I would like to know for me, I'm embryologist, and it's very complicated to say if this oocyte is normal or if this oocyte is abnormal. Donc, I like to know your criteria objective
Yes.
for qualification.
So I speak of degradation because, like with microscope observation, there are some abnormality that are classified like degradation of oocyte, like the polar body or 2-3 polar body mice. This is the characteristic of degradation, and I suppose that there is an apoptosis process, but I cannot be sure because we need other studies to confirm the apoptosis. Just we make the staining with DAPI and just to see that this pool of oocytes are degraded because we have DNA spread all over the cells.